Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hello, everyone, and welcome. This is Dr. Jill Jin, internist and senior physician advisor here at the AMA. On today's podcast episode, I'm joined by Dr. Linda Brubaker, who is the Director of Physician Wellness at University of California, San Diego, and Dr. Nicole Goldhaber, who is a resident physician in general surgery at UCSD. Our topic of discussion will be mandatory training requirements for physicians, or what the two of you have referred to as mountains of modules, that are often not related to relevant clinical education, but rather regulatory compliance or other irrelevant topics. And specifically how the two of you work together to consolidate and reduce these requirements at UCSD. So welcome and thank you both for being here today.
Thank you. We appreciate the opportunity to share this work that's very important to both of us, and we're just at the beginning of what we think can be a very high impact intervention to reduce physician burden.
Absolutely. Before we dive in, could each of you share a little bit more about yourself and your background with our listeners?
Sure, I'll start. My name is Nicole Goldhaber. I'm a surgery resident at UCSD in my third clinical year, but in between my second and third clinical years out of 5, I took 2 years to do some really cool work at the institution, both in quality improvement spaces and informatics spaces, and most importantly, in my opinion, the wellness space with Dr. Brubaker, and to work on this project as well as others, just helping our workforce here at UCSD be the best that they can be.
Excellent. Dr. Brubaker?
And my name is Linda Brubaker. I'm the Director of Physician Wellness at UCSD, and it's been my honor to lead this initial effort that our institution committed to several years ago and get the infrastructure and groundwork set up with the goal of creating an extraordinary physician wellness culture at UCSD. I have significant administrative experience from prior work in academic medicine, including serving as the Dean of the Loyola University Stritch School of Medicine. I brought several key perspectives to this work, and it's been an absolute pleasure to have Dr. Goldhaber partner with me to work on this Mountains of Module project. And this has continued with several different key players at UCSD, and we have a full project underway now to advance this work.
Excellent. So let's go back to the beginning. How did this project come about? What motivated you to try to tackle this fairly universal problem for physicians and trainees?
Part of this starts because we are part of the National Academy of Medicine group who is working to reduce administrative burden on physicians. And I have yet to meet any physician who enjoys the mandatory training assignments that they get. And it's a source of significant administrative burden, and it does not align with typical adult learning principles that are evidence-based. People find these unnecessary, irrelevant, time-consuming, and often uncompensated work for them. Mandatory training detracted from the wellness of the physicians in our system. And as we began to just talk to others in other systems, this sounded like it was a pretty universal concern. And we thought this would be a reasonable place to start. And I think Dr. Goldhaber has some ideas on this as well.
Yes, thank you. I heard about this project from Dr. Brubaker and could not be more excited to help address it, because as one of those physicians in training, but there's even more of these mountains of modules I feel like that we have to go through. And so any way we could reduce the burden on our physicians and really all of our staff members would help overall wellness of those people, reduce burnout, as Dr. Brubaker mentioned. And so as I have had to do many of these modules myself, it was definitely motivating to try and tackle it.
Can you give me some examples of modules you had to do, or just the number of hours you have to spend every year, or just the scope of the problem at UCSD?
We sure can. And that's one of the first things that we tackled. We became aware pretty quickly that there's no evidence anywhere that assignment or completion of these mandatory modules does anything but allow someone to check a compliance checkbox. We don't have any evidence that it actually changes physician behavior or improves a knowledge base. But we also hear time and time again that it does help with compliance. And sometimes these are important regulatory compliance issues. But the people who are assigning these don't always have the idea of the broad scope of the administrative burden for the physicians. So their perception of a simple solution, oh, let's assign a mandatory training module, they don't realize that that could be the straw that breaks the camel's back, that there's just too many of these assignments going on. And one of the first things that we recognized is that there wasn't really anybody regulating this locally who was saying, well, let's assign another module and let's do more. This, why not assign another module? The cumulative burden was just getting to be very, very burdensome and very oppressive. And we just wanted to shine a light. And so we first started by gathering some of the data that Dr. Goldhaber could talk about.
Yeah, so we asked ourselves the same exact question you just asked us, like how much time are we really spending on this? Is everyone spending the same amount of time? How many modules are there? Are they really necessary? And we found on average, and we looked at a year of data, which was still tons and tons of data because every physician at our hospital and every module that they have to do, we have recording or we have data looking at how much time was spent on each module to reach completion. And so we found that there's an estimated median time of about 296 minutes per physician per year in this case. So that's almost 5 hours. And so just completing those 6 modules takes about 5 hours per physician. And when you think about, at least, I don't know, as a surgery resident in training now, 80 hours a week is supposedly my limitation on my hours. But so adding on 5 extra hours to do these modules somewhere takes me not only out of compliance, but takes away from, like sleep and other important things we have to do as human beings. And so it's also, as Dr. Brubaker mentioned, not compensated oftentimes. So since we are spending so much time working clinically in many, if not all specialties, it's hard to find time during a workday to get these done. And so oftentimes we're doing these off hours or on the weekend, which then brought us to our next question and our next thing we looked at in the data, which is how often are people really doing these off hours? And are there differences when we look at, the gender of a physician or how long they've been at the institution or what specialty they may work for? So to summarize that, we found that really off hour starts occurred for about 1/3. So outside of the range, I think we did 7 a.m. to 7 p.m. About 1/3 were occurring outside of that range during the week. And then over the weekend was a very similar range as well.
One of the key points that we want to make here is the data that we're talking about today is clearly an underestimate. As Dr. Goldhaber said, we only looked at 6 key modules, and these were because they really are prioritized mandatory training modules that the university regents look at. And we know that there are many, many other modules that are assigned perhaps by departments or clinical units. And so we didn't even look at those in this first blush. So when we saw the administrative burden just from these 6 modules, just over 1 year, it was pretty shocking.
Yeah. And I think you've already highlighted a few other key points. One being, the perceived regulatory compliance versus what is true regulatory compliance. I think a lot of times organizations take it upon themselves to interpret these regulatory guidelines and turn it into local policies that then they feel obligated to enforce, even though it was never, a true regulatory requirement in the first place. So that kind of disconnect between what's actually law or legally required versus a local policy that was implemented. That is, I think, one of the breakdown points, as you've mentioned, Linda. And then the other point of, 5 hours per physician per year, it sounds like a lot to any practicing physician. It may not sound like a lot to an administrator, but again, if you multiply that by the total number of physicians at the institution, the total amount of, if it is being done during work hours, the amount of lost patient revenue, the lost RVUs from doing that during work hours, that adds up. And then finally, with the fact that many people are doing it on their off hours, this added work outside of work, of course, is very detrimental to work-life integration.
the revenue piece that you bring up, it's really astounding. We broke that down as well. And we know that based on these analysis, the total physician time for this single group was 9,185 hours spent on these modules. So using just a conservative average of physician compensated rate of $167 per hour, the estimated cost of having our physicians complete these modules is over $1.5 million. So seeing that this is an uncompensated activity that's either taking away from clinical time or being done outside clinical time, it's really kind of astounding to see those numbers that way.
Yeah, indeed. So, after getting this initial background data and costs and the scope of the problem, who are the key stakeholders you involved in trying to reduce this burden and change this process?
Well, we're very fortunate at UCSD to have a very engaged leadership group around physician wellness. And as we brought these initiatives and this data forward to them, they were also able to align with this. They don't like doing these mandatory training modules either. And administrators also get stuck with this kind of stuff. And we realize this is an issue across the entire healthcare workforce, as well as the administrative support teams and executives. And so the good part about this is people line up with these efforts very, very quickly. They recognize that we can do better than this. We can use our healthcare workforce time in a better way. And so one of the first things that they did is help us begin with initiatives such as simply defining what mandatory training. And Jill, you mentioned the issue of finding the actual regulatory language. And so now for UCSD, we require what is the federal or the state or the university policy language or the OSHA, what exactly does that regulation say, what is required? And we haven't found any that say it has to be a slow-moving 60-slide PowerPoint that you can't go on double speed or anything like that. So we know there's a lot of opportunities to trim burden from the way these are assigned. And then we're also working diligently with our team at UCSD to put in filters for who is allowed to assign mandatory training. Just because I think it's important that somebody get trained in this doesn't mean that our 1,680 physicians should get assigned this module. It just doesn't work that way. And so now we're beginning to review that and looking for the opportunity to assign CME credit and award CME credit as an incentive, as an reward for this effort, since there's otherwise uncompensated activities.
Gotcha. So is it a compliance officer that you're working with that's on board with this, or?
Yeah, we've got a whole mandatory training team that's working together with our Office of Compliance and Privacy and our HR for our health system and our CMO and our physician wellness office. So we've got everybody pulling in the same direction to make sure that the important institutional regulatory needs are met. So the institution, the patients, everybody needs to be protected. And simultaneously, we can reduce the physician administrative burden. We really believe that if we can reduce the burden, we can improve the compliance. And so we think that we're going to be able to make good progress. That's a win-win for the institution and a win-win for our physicians who are facing unprecedented levels of burnout.
There's always going to be some regulatory compliance that we can't get away from, but the goal is to minimize it and not overinterpret those guidelines, which I think is sometimes the knee-jerk reaction.
Completely. I mean, if you take it to the absurd extreme, you have all the physicians sitting in their desks doing their mandatory modules 365, and no patient care is happening, but boy, we got good compliance scores, right? So we're here to take care of patients. We need to be cognitively healthy to be able to take care of those patients, and we need to reduce administrative burdens in a significant way, including mandatory training requirements.
And how long did it take you to roll this out, this first round of changes that you made to the modules?
I would say over several months, but it's a very iterative process. Each month that we meet, I mean, even week to week, we make changes. UCSD is not done with this yet. We got a lot more to go.
Yes. And truly what I really like about this story is this first part of getting started. In particular, with you, Dr. Goldhaber, how you were able to claim agency and make such a big impact. With AMA Steps Forward, we talk about change from the top down a lot, but also we'd like to remind people that the bottom up is also very possible and important. So with that in mind, do the two of you have any final practical tips or pearls of wisdom for practicing physicians, trainees, or health system leaders who may be inspired to take on this project?
First of all, thank you for those kind words. I definitely cannot take all or too much of the credit for this project at all. It was very much a team, multidisciplinary team effort. And I think that is one of my biggest pearls going into anything like this is you really need a team that encompasses every direction that you could look at this. And I'd say also as you are looking at data, there's lots of different ways to look at these numbers on a screen in a spreadsheet, whether it's more qualitatively or you need those statistic tests, or if they seem like they're not making sense in one way, maybe there's a different way to look at it. So I think the two big things I learned is really the importance of a multidisciplinary team and just team in general, as well as thinking creatively about how numbers on a spreadsheet can lead to meaningful information and meaningful change at an academic institution.
Yeah, I would just say the startup on this is actually sort of still ongoing because each time we pick up a rock, each time we say, well, who's responsible for this part of the process or how exactly does this work? We're finding things that kind of make us like, really? Oh, well, that's kind of interesting. And the onion gets peeled back another layer. So while we're moving forward with actionable improvements in this system and education of our senior executives and our health system leaders, we're also discovering more that will need attention. And this affects patients indirectly too, because we don't want physicians to be worn out from mandatory training and less present for patient care.
Yeah, exactly. And another thing I wanted to ask is, you mentioned it's a slow process and it's not, one big bang of a change. How much have you shared with your physicians that you're working on this project, or how much have you told them, this is a project that we're prioritizing, that we're trying to make changes on? It's a slow change, but we're really making this effort and just keeping them updated on the process.
Yeah, we are sharing pretty frequently. At UCSD, we have a pretty well-developed administrative infrastructure for physicians' wellness. We have department wellness directors in every department, at least one wellness director for every 75 physicians. So larger departments have multiple wellness directors. And we have a way to cascade information to them and receive information from them in a pretty ready format. That is backed up with periodic quarterly forums where we call them Deep Well, where anyone who's interested in physician wellness can join in and listen. And this is accompanied by newsletters and email communications. And we know that those are not effective for everybody, but some form of communication for any physician who actually wants to hear about the work that's being done is available. And then, of course, we have a very robust physician wellness website, which is available publicly. We try to communicate this, which doesn't mean every physician knows about it, but we do our best to push the information out.
Right. Because I do imagine just sharing that you're trying is oftentimes helpful. That often engages physicians. And even if the results, like you say, aren't immediate or the physicians aren't immediately happy about this amount of decreased burden, it's at least the fact that they know you're doing something and trying and working on it is important as well.
You're so right. And being convincingly clear that you're listening and coupling that with tangible actions that are meaningful for the physicians has really been a good method for us at UC San Diego. And although we have still a lot of work, there are many challenges that affect physician well-being and physician wellness and the electronic medical record, operational issues, etc. If we just keep chipping away at these things and making changes that really improve our physicians' wellness, it's going to make a big difference in our ability to reduce burnout. And we are very committed to that and to making an extraordinary physician wellness culture at UCSD.
Well, thank you so much for joining me today, Dr. Brubaker and Dr. Goldhaber. I've learned a lot about this process, and I'm sure our listeners have some great takeaways as well.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.